Okay, we're going to continue on with our lecture and go into prioritization. Prioritization. Prioritization definition is deciding which needs or problems require immediate action and which ones can be delayed until a later time because they are not urgent. So you need to know which to do first. However, you need to consider any implications of delaying any of the other activities. So there's 3 levels of priority setting, which we probably already know the first one with ABCs. They added V, which is for vital signs, so airway, breathing, circulation, or changes with the vital signs. Those are first. Second would be any other medical problems, so you're going to look for changes in mental status, any abnormal lab values like blood glucose, pain, untreated medical issues, etc. And then the third priority would be chronic problems, teaching, and coping. Always remember the nursing process. Do your assessments before any interventions. So coordinating assignments. So you will coordinate daily activities for yourself and also while supervising either LPNs or any other assistive personnel you work with, such as your CNAs or patient care technicians. There's critical pathways, concept maps, and computer information sheets that will help identify needs, but they won't necessarily provide a mechanism for coordinating the completion of tasks. So in order for you to assist with coordinating assignments, you need to consider planning time around activities that occur at specific times. So high priority items always are first. And then, are there any items that you can cluster together? So a lot of times, if you know you're going to be going in there for your morning assessment and meds, what else can you cluster at that same time? Can you finish charting and documenting your assessment then? Is there any education this patient needs right now? Can you address parts of the care plan while you're in there? It will tremendously be helpful for you to learn and to get in the habit of clustering your care for your patients. I don't know how many times I've gone in a room and you're in the head to toe isolation gear and you forgot their water, or you forgot a straw, or you forgot the pill cup. And it just takes up so much time when you do these missteps in your care. And then 2, evaluations and reassessments. So, another thing is if this patient's supposed to be discharging today and they're still on oxygen and they don't use oxygen at home, let's titrate that oxygen down. If they're on IV pain medication and they're supposed to be going home today, let's transition them to oral narcotics and see how they work for them. Blood sugars too. But remember, what other tasks can you delegate to others that involve evaluations and reassessments? And then certainly, if you have other nurses around you that are willing to help, utilize them. I'd say whenever anybody offers you help, never reject it. Okay, here's a quick case study. So this is Mrs. Arnold. She's a 62-year-old who was brought to the hospital by paramedics. She has severe dyspnea, productive cough, and is very anxious. Her past medical history includes a right partial mastectomy and radiation and chemotherapy 6 months ago for the treatment of breast cancer. She's also asthmatic. She had stabilized in the emergency department and was then transferred to the unit. In the emergency department, she had a chest x-ray along with a CBC and electrolyte tests. An IV of normal saline was started in the left hand, infusing at 75 mLs an hour. Vital signs are as follows: temperature 38.2, tympanic, respirations 32 per minute, heart rate 122 per minute, irregular, blood pressure is 148/86, pulse ox is 86% on 1 liter, via nasal cannula. And then the healthcare provider orders once a stat ABG and then a repeat in 2 hours, CT of the chest and lungs with IV contrast. So I'm going to change those fluids from normal saline to D5 half LR with 20 of potassium to infuse at 100 an hour. And then you're going to increase your O2 to 3 liters a minute. Continuous pulse oximetry, cardiac monitor, and then call the oncology consult. So you got a lot of things to do there. So this would be a good time to pause. I'll keep going, but it's a good case study to work on when you're looking at prioritizing care. So look at all of those healthcare provider orders, and remember looking at your ABCs and your vital sign changes. Put those in order of priority and then explain your rationale. Why would you want to increase the oxygen from 1 liter to 3 liter first? What would be your rationale for that? Which of the tasks could be assigned to an LPN? Do you have to do all of these? Can an LPN increase the oxygen for you? And then what other tasks could be assigned to the assisted personnel? Can they put on the continuous pulse oximeter? Probably. And then as the admitting RN, what nursing interventions would you implement? And then explain your rationale. So go ahead and complete that case study. You can pause right here and then come on back when you're done. So also some review questions on prioritizing care. You can look at your book there, The Essentials in Nursing Leadership and Management. There's textbook resources on the Davis website. Click on the online review questions and click on Unit 2. And then, of course, you can click on Chapter 6 and complete the questions. So moving on, we're going to look into Chapter 8, which is Resolving Problems and Conflicts. Conflict is a daily occurrence in the life of a nurse. It happens all the time. It may be small, it might be large, it can even be your patient refusing to take a medicine because they don't want to. It can be a huge disagreement with a physician. It can be small issues and large issues. And stress definitely leads to difficulty concentrating, anxiety, sleep problems, and with sort of withdrawal of activities. You just kind of don't want to do anything. And I'm sure this time of what's going on in the world is very evident of how stress leads to all of those things for everybody. And then you can also have some bitterness. You can have anger and violence in the workplace, and that can erupt too if conflicts are not resolved. So let's identify some sources of conflict that you might encounter as a nurse. So there can be some power plays and competition between groups. You can also have some bullying and nurse-to-nurse lateral violence, or NNLV. You'll find that too. That was kind of a good example of when you had the old eating up the young nurses, and how I think in a way it's lessened some, but it does still exist. So that's an example of bullying. Increased workload, so you have to do more in less time. The managers, nurse leaders are always constantly looking at cutting costs. And then sometimes you can feel taken advantage of, especially if you're the one that's always volunteering to help. There's multiple role demands. Not only are we in there doing medications and assessments, but we're also doing other things. We're cleaning up the room, we're fixing phones, the TV's broken, trying to find a charger for their cell phone. It is so many other things that are involved. And then too, you have the increased threat to safety. There's scarcity and then security, and then you worry about layoffs too. That's definitely increased with the threat to safety. And then scarce resources between departments or individuals. Depending on staffing and the acuity of patients, that can be an issue. There's also cultural differences. There's language barriers, work ethics, time. That can be real challenging when you have a patient who doesn't speak the same language as you. And then there's also ethical conflicts. So, you're having to record care that wasn't given. if there were some issues where there wasn't an informed consent received, or look at the example that we did with discussion board 1 and that assignment, and that was definitely an ethical conflict. And then 2, there might be some invasion of your personal space, especially workspace issues. We tend to work in close contact of each other. So here's some conflict resolution myths. There's a few of these here. So there's the win, lose, draw myth, where some think problems occur at work in the same way they take place in sports, where one has to win, one person wins and the other one loses. But when you're looking at conflict resolution, we found that working more effectively is about working together. So if you work together to solve the conflict, it's more effective overall. Aiming for a win-win, where both sides gain some benefit, is the best resolution. And just knowing that sometimes people are unable to reach an agreement. So what do you do in that case if you guys cannot reach an agreement? So I think best thing to do is just be able to accept, recognize each other's differences, agree to disagree, and then doing that will help the conflict pass and everyone can move on with the work. There's also one myth that's called the fixed pie method, where I get half and you get half, and really that's just not necessary. It's a lot about trying to figure out how to work effectively and negotiating. There's also the de-evaluation reaction myth, which if people say that if the other side gets what they want, then it's bad for us. So again, these are just myths. And then here are some signs that conflict resolution is needed. And if you go to page 120 of your book, it just lists the signs that conflict resolution is needed. So if you're feeling uncomfortable, if members of your team are having trouble working together, if team members stop talking with each other, and then if team members begin losing their cool and attacking each other verbally. So the overall process of conflict resolution includes problem resolution, negotiating informally, and then a formal negotiation. So this is figure 8.1 on page 121, the process of resolving a problem. And you can see this cycle of circles. And what you're going to do first is identify the problem. You begin here, identify the problem, generate possible solutions, then evaluate suggested solutions, choose the best solution, implement it. Problem is resolved. If yes, then you end the cycle. If not, then you need to repeat the process. So when a disagreement has become too big or too complex for problem solution to be successful, like this last figure that I showed you, you might need to utilize a more elaborate process to resolve the disagreement. So this more elaborate process includes the informal negotiation process. So refer to box 8-2 on page 123, the informal negotiation process, and it discusses the scope of the situation, and then you'll set the stage for negotiation. You'll conduct the negotiation. You'll set the ground rules, then you'll clarify the problem. You'll make your opening move, and you'll continue with offers and counteroffers, and then agree on the resolution of the conflict. So conducting a negotiation, it's really important to manage emotions. I mean, a lot of times you're discussing really, really heated conflicts. So box 8-3 on page 125 has a list of tips for leading the discussion when you're involved in negotiations. And I can tell you that I was the treasurer for our union at the hospital I worked at in Oregon. So I was involved in a lot of the negotiation processes, and it is exactly like what it says with conducting a negotiation. And you'll have the members of the union negotiation team along with the managers, and typically it's like your head honchos are there too, your chief operating officer, the chief nursing officer. They're also there along with managers of the departments and then human resources. So, and it's important to manage the emotions so that you can get across the points that you have, um, effectively. And then you'll set ground rules. You'll have the opportunity to clarify the problem, and you'll typically kind of go back and forth between management and the other side negotiating to identify problems on both ends. And then you'll discuss the opening move. You'll discuss on what negotiations can be made. You'll definitely emphasize the areas that you both agree on, and then you'll also emphasize the areas that you disagree on to encourage further negotiations. And then you agree on a resolution of the conflict. And a lot of times it's back and forth until either side gets what they want. And it's sort of you're having to present the case of why in this negotiation you feel that this clarification of the problem is better than what they're presenting. But yeah, it's definitely a process that's utilized with union negotiations, at least from my experience. And then this talks more about the collective bargaining unit, which is union that I was in out in Oregon. So that's more formal negotiation, which is the collective bargaining. So it involves a formal procedure governed by labor laws, and then contracts may cover some or all of the following. So you'll have economic issues within the hospital, management issues, practice issues. If I had you guys in class, I would have passed around my, I have a little book for the hospital where I worked at, which was the union contract. And then every 3 years we renewed it. So every 3 years we would negotiate. Majority of the time, things that came up every 3 years were pay. We would have pay increases every 6 months, and it'd be a certain percentage. And then they, would negotiate vacation time and guaranteed wages and guaranteed hours. We would never be, if the census was low, we were guaranteed at least 75% of our wages. So they could send us home for up to 16 hours a pay period if we're working full time at 72 hours. So it's nice knowing that they couldn't just completely, cut you out of having income because of low census, which honestly was fairly rare that happened, but it did. So there are advantages to having unions and collective bargaining. We'll go over that in a bit too. So I do want you to take some time to read the case study on page 126 and then consider if this is something that could be implemented in Virginia, why or why not. And then you certainly can use electronic resources to search for this answer. So I'm going to give you time to pause. So go ahead and pause the video now, and then we'll come back and I'll talk about it a little bit. Okay, so what I wanted to mention about whether or not with this case study, if it could be implemented in Virginia, and the answer is no. Virginia is a right to work state, which there are, the same majority of states are a right to work state, but it's different when it comes to at-will employment, and that's the difference between right to work and at-will employment, and if they can just fire you for no reason. So a right to work state means that employees cannot be required to support collective bargaining or a collective agreement. So say if we did decide to have a union for nursing staff at Riverside, then, you know, a collective agreement negotiations contract would be made, but those nurses and employees could choose against being a part of the union. And then further, an employee may be dismissed for any cause in a right to work state, so which really is at will, employment at will. So the other big issue with this is that the existence of a collective bargaining agreement would not prevent that from happening in these states. So if it is an at-will employment state like we are, even if you had the collective bargaining agreement, it wouldn't prevent that from happening. Whereas in Oregon, the contract was what sort of governed decisions about, getting let go at work, layoffs, and then getting fired. So it's a little bit more difficult to get fired because of the bargaining unit that we had. Okay, so here's the pros of collective bargaining. It does protect workers' rights. If you were ever at a point of discipline or something that happened, you had the right to have union representation there with the meeting along with the managers and HR. They were there to support you and to make sure that everything they were doing was following the legal guidelines of the contract. And then again, grievance procedures are available. So if you disagree with something that the management did, you could file a grievance procedure. You tend to get higher pay, and let me tell you, that is very true. And then it's empowering. I mean, you are giving staff the opportunity to make decisions about nursing. And it is empowering for staff to be involved with the higher management, nurse leaders, to support your nursing staff members, for sure. Well, so what are some of the cons? It can create management staff barrier. I have to say, in Oregon, we had really good relationships with the management staff, so they would listen to us. There wasn't a lot of conflict, and the negotiations were fairly peaceful, but there are cases where there can be some bullying from management to staff, and you can find that. It's definitely a con with collective bargaining. It also does add some rules and regulations. I know that it makes staffing much more difficult for managers when it comes to having a collective bargaining agreement. And then it does drain managers' times. I mean, these contracts are pages and pages long, and they're very detailed in legality, so it's time consuming for managers to keep up with the contracts. I've got another case study for you here. This is Min Lee and Sue Tong, were the director and assistant director of nursing, respectively, of a 250-bed nonprofit community hospital. Both cared deeply about providing high-quality care, and both loved their jobs. Min thought nothing of staying until 8 p.m. to finish paperwork or catch up on email messages. She enjoyed the quiet of the administrative suite after the staff had gone home for the evening. This was the time she did her best thinking. Sue, on the other hand, preferred to come in early, work industriously, and then leave promptly at 5 p.m. She was focused, efficient, and finished paperwork and emails that she thought kept Min so late. She had to be home on time. Her children were in aftercare until 6 p.m., and if Sue picked them up even 5 minutes late, she was fine. And if it happened too often, she'd have to find an alternative childcare solution. So Min often asked Sue to stay late to work on something that could have been done before 5 p.m. Sue would remind Min that she had to leave promptly at 5 p.m., but Min clearly was unhappy that Sue would not stay. Min began to criticize Sue's work, appearing to go out of her way to find fault with Sue's work. Tension grew between the two, eventually leading to an argument during an executive committee meeting. Sue knew this could not go on for much longer, but did not know how she could resolve her problem with Min. So some questions for that case study. What do you think is the source of the conflict between Min and Sue? Which type of conflict? Is it power play? Is it they have scarce resources? And a lot of it, I think, is communication issues. What can Sue do to resolve this conflict? Can she work out a plan using the approaches we just went over with problem resolution and informal negotiation? And then describe how you would try to resolve the conflict if you were Sue. Which of the approaches that you described in question number 2 would be most appropriate for resolving this conflict? Explain your choice. And then how could Min and Sue have prevented this problem from escalating into an argument in public? And to be honest, my thought on that is early intervention and communication. So I won't go over my answers to the case study. This is more for you to have an opportunity to review and reflect on what we just learned and put it into a scenario and answer the questions based on what we just learned. So if you want to pause right now, I can certainly work on the case study and then I'll continue talking. All right, some quick review questions here again. We're almost done. So navigate to your book, Davis website there, Essentials in Nursing Leadership and Management, and then go to the online review questions, click on Unit 2 and click on Chapter 8 and complete the questions. For those of you who didn't do this for the last review for the test, it might be a good option for you to go through and study these online review questions for the chapters that we did. And I think that's it. So I will put out a PowerPoint and audio recording of Test 2 review hopefully by the end of this week, if not definitely by Monday. And then our test again was moved to next week. So if you have any questions, please let me know. Thank you very much.